Alright, for this week's discussion, I chose an article titled Optimizing the Management of Depression in Children, and it was published in August of 2020. And when you first look at the article, the first sentence is bolded and in a different color, and it really points out, and it really shocked me with what it says. And it states, overall, 3.2% of children aged 3 to 17 years old have been diagnosed with depression. And these are just the ones reported, not the ones that don't have the funds or ability to afford or get to these places to help children and adolescents, or just the ones that don't tell their parents. So, and it also states between 40 and 70% of young people that have a major depressive disorder may also have another mental health condition. Most common are ADHD or OCD, eating disorders, anxiety that come along with it. The article discusses all the symptoms of depression and the signs. First, look at the signs of depression and what to look out for. And some of the symptoms are depressed mood, feeling sad, empty, or hopeless, decreased interest, or a change in weight or sleep. And to be diagnosed, you must have a minimum of 4 of these symptoms that are present for at least 2 weeks and cause significant distress to the child or adolescent or whoever is going through these things. And after the diagnosis, you go through this risk assessment, multiple of them actually, to determine how much of a risk you are to yourself, to others, how severe it is, if there is a risk factor at all. And these assessments should be done frequently to evaluate the risk of potential harmful incidents, because the degree of potential harm can change quickly. So during the risk assessments, you go through the safety plan that the doctor, psychiatrist, whoever it may be, comes up with to help the child or adolescent with depression. So some of these are referral to child mental health services, which is also known as CAMHS, increased parental supervision, or sometimes even telling the parents or parent for the first time about their child and like what they're feeling, what they're going through, the diagnosis, whatever it is. And the safety plan is put in place to reduce the level of risk and for the family and for the kids and surrounding people. The article also goes through the idea of suicide and how big it is in our country and this world, and ways to prevent that, and a first look at that. So that really is important, because I think suicide is one of the leading causes of death, and it's part of the healthcare system where not everyone gets the correct treatment they need, and they feel alone and all these feelings, and they can't handle them, and they choose to take their own lives when it possibly could have been prevented. So some of the statistics that the article talks about is, for every 100 reported suicide attempts, 1 is completed in a child or adolescent's case. And a recent study has shown that the incidence of suicide in adolescent boys is greater than girls by more than 2 times. And self-harm is much more common in girls than boys. So this article just discusses the idea of depression and what to look out for, and the symptoms, and how to go through the process of getting diagnosed and getting help, and how overlooked this huge issue of depression and suicidal thoughts and sadness is in our country for kids that are so young, that probably don't know what's going on and feel lost and helpless. And it is our job as social workers and as a country to support them and be there for them and give them the correct resources that they need to get help and get the medication they need or therapy that they need to hopefully improve their lives.